Wonderful. So you're talking a lot about the different, so she has you have a process document for all of your different tasks that are shared with Rose. What are some of those tasks that you have Rose doing for your practice? I mean, and this isn't just my question, okay? Again, when I was at the conference with the occupational plastic surgeons and we were talking about VAs, they said, will you please ask Dr. Mettu, not like, hey, she does insurance verifications for me. Okay, that's one thing, and we can understand what that is. What are some other things that Rose does for you as far as tasks go?
Yeah, she does a lot. And really everything that can be done remotely, she does. And Rose, I'm probably going to miss some things here as I try to list them off so that you can chime in if, with whatever I miss. But from scheduling appointments, incoming referrals, outgoing referrals, scheduling surgery, CT scans, MRIs, getting authorization for all those things, confirmations, contacting with the patient themselves or just letting referring doctor's office know patients are scheduled. She pre-charts, follows up on denied insurance claims. You mentioned insurance, like verification of benefits, eligibility. She does that. Not only that, actually, though, she'll also calculate how much a patient will owe, based upon these deductible plans, co-insurance plans, or even copay plans. So identify with insurance how much a patient will owe and communicate that to the patient in advance. That's one of our processes to inform patients ahead of time, not at the appointment itself. And so she does all of that in advance of the appointment, make sure all the appointment notes are updated with why a patient's coming, what Shayla needs to collect here in the office, just everything you could do remotely. Rose is doing it.
And Rose, just for you, is there anything that Dr. Mettu, he covered a lot of stuff. That was an impressive list, by the way. I was trying to sit here thinking with my job, like Mike has me doing stuff for him. I'm wondering if I do that much for Mike. but is there any other tasks that you do that Dr. Mettu didn't mention?
Let me see. Yeah, I also reaching out patients because recently when Dr. Mettu asked me if what would be the best way to provide good customers for patients, because we are just three, Shayla, Dr. Mettu, and I. So most of the time I just send text messages to the patient, and then I just realized that why not I am going to call directly to the patient so that it will be more easier for them to set up an appointment or to ask what are their concerns. So yeah, that's one of the tasks that I'm doing every day. So I am calling patients just to ask if they would like to set up an appointment, and then I'm going to reach out to referring doctors also, because sometimes Dr. Mettu will ask me to refer some patients to another provider. And what else? I am also following up claims to insurance companies, and yeah, something like that.
Awesome. Wonderful.